Hey guys, what's up? What's up? What's up? Okay, um, I'm here for another section of the Nclex. Today we'll be doing questions on management and leadership in the Nclex. So, what you have to know in this section, this is part of the management system that has to do with delegation, prioritization, management of disasters, and emergency response situations. So today we're seeing the first part of it, which has to do with management and leadership. What Increase wants you to know is where you're working, try to know some organizational structure and some types of leadership styles and how it goes. So that's what we do in this area. I know most people do not pay much attention on this area. I advise you to just watch this video over and over, listen to it, and enjoy it. Please stay to the end of this video because I have some information for you at the end, which will help you. Let's go. Let's take number one question. Okay. It says, the nurse manager is appropriately using an autocratic method of leading the team. Which situation does the staff nurse demonstrate this form of leadership? Okay, this is a leadership style, you can say leadership type, autocratic leadership system. A says planning vacation time for the staff on the unit. B says directing staff activities if a client has a cardiac arrest. C, evaluating a new medication administration process. D, identifying strengths and weaknesses of an education video, which is the right answer. The right answer is B, directing staff activities if a client has cardiac arrest. Let's look at what autocratic style of leadership is. Just from its name, we know that it's a top-down leadership where the nurse manager imposes activity to the nurses and gives solutions without seeking the consent or the opinions and views of other nurses. This is what it is. But the good side of this type of leadership is that it excels during crisis. What does that mean? It means during crisis, the nurse manager who practices this type of leadership exercises this type of leadership by giving command where we don't have time to waste, okay? In critical decision situation, in critical moments like this cardiac arrest, the nurse manager or the nurse or whosoever practices this type of leadership comes in and gives command. You don't have to wait to seek the opinion of anybody. Okay, this is the good side of this type of leadership. Okay, the bad side of it is that it demoralizes team members, right? It doesn't give you the opinion to give your own point of view. Okay, let's use this question to revise the other leadership styles. We have what we call democratic or participative leadership style. In this one, the nurse manager seeks the opinion of the team members, okay, before taking decision. It involves others to provide input. It empowers towards excellence. It analyzes input to make decision. It is more team satisfying. Okay, so this is a type of leadership that has to do with, you see, planning vacation time for staff on the unit is participative, right? It is. So let's see the other one is called laissez-faire, just from the word, it's a French word, laissez-faire. It means you do your thing by yourself, free way, okay? The right word is free way. You take your own decision. You have little or no assistance from the management. And the main role, of the management is just to advise and support, you go ahead, do your thing by yourself. There is team disagreement that result to lower morale. So this is what we call a laissez-faire system of leadership. Let's look at situational leadership. Okay, just from the word, it comes in depending on a particular situation, like during emergency, where the nurse manager has to take decisions. So at that point, we might see some autocratic leadership coming in to add to situational leadership. Okay. Let's look at some leadership models. We have what we call transactional nursing. What does that mean? It focuses on institutional goals. So this leadership style motivates staff with rewards to meet the goals of the institution. Rewards could be either recognitions for excellent performance. This is called transactional nursing leadership model. We have transformational. It's just like similar, but what happens is that the workers and the leaders, they encourage each other to meet the desired goals of the institution. Okay, so this one is more inspirational. This is take on words that I want you to lay more emphasis on. It says it is inspirational, it's considered as an inspirational leadership model. So let's look at the second question here. We have new evacuation procedures are being developed for the unit by a tax committee at a long-term facility, but have not been approved. A bomb threat has occurred in the facility. Which action by the nurse manager is appropriate? A, tell staff members to use personal judgment to determine which procedure to follow. B, ask staff members to quickly meet among themselves and decide what procedure to follow. C, have staff members assemble as a group to quickly offer their opinions about what to do. D, inform staff members that the procedure currently in place must be followed at this time. Which is the right answer? D is the right answer. This is part of disaster management when we are going to see. I will prepare questions only on that. But there's something here very important. There's something I explained in the first question. This nurse manager has applied some sort of autocratic leadership here, right? What did I say? It excels most during crisis. You don't have time to tell staff members to sit down and think of what to do. You just take action, despite the fact that the procedure has not yet been approved. It's put in place, just waiting for approval. This nurse manager has the right to say, this is what we have to put in place. Go ahead and implement this procedure. This is what is there. This is a crisis situation. It's just similar to the first question, right? So during emergency, the nurse manager has to think on the best course of action to take for the safety of the clients and the staff, right? This is what we're saying. Other options will delay action. Let's look at number 3. Okay, number 3 says, a nursing graduate is attending an agency orientation regarding the nursing model of practice implemented in the healthcare facility. The nurse is told that the nursing model is a team nursing approach. The nurse determines that which scenario is characteristics of a team-based model of nursing practice. A, each staff member is assigned a specific task for a group of clients. B, a staff member is assigned to determine the client's needs at home and begin discharge planning. C, a single registered nurse is responsible for providing care to a group of 6 clients with the aid of the assistive personnel. D, an RN leads 2 licensed practical nurses and 3 APs in providing care to a group of 12 clients, which is the right answer. D is the right answer. We are going to see. Now, this is a type of nursing model. We are going to see different types of nursing models. There are about 3 or 4 of them. This one focus on the nursing model. It says team nursing approach. Team nursing approach is led by a registered nurse with other team members to provide care to a group of patients, a group of clients. So that's why D is the right answer. I take it over. The registered nurse is the team leader. And then he works with other care personnel, the LPNs and the CNAs. Each care personnel practices depending on the scope of practice and the job description. And they do that on a group of clients. Another name for team nursing is called modular nursing. Modular means the unit is further divided into groups and patients are classified from geographical perspectives. And a registered nurse is assigned with LPN and CS to take care of this group of patients. It is group-oriented, right? That's what we say in this type of model. So the advantage of this is that there is collaboration and communication amongst team members. Let's look at other options. We have what we call primary nursing, just from the word primary care nurse, primary nurse. You are the primary nurse to this patient, right? It means you are responsible to provide care to this patient, to provide all the activities of this patient for that shift. So we say this type is what? Client-oriented. One nurse is assigned to provide all the care to particular patients. Okay, during that shift. So in this case, it keeps you to be at the bedside, okay? You are at the bedside and you continue to provide care, individualized patient care. Let's see the difference between the other model. Functional nursing, or we call relationship-based practice. What happened? From the word functional, task, right? Functional, task. So it is task-oriented, meaning a group of a particular nurse is assigned specific tasks during that shift. You come to duty, you say, Nurse Brian, you will take care of medication. You provide medications to all the patients in the unit for today. Nurse Per, you will do all the assessment and wound care. Nurse Belinda, you do all the admission for today. That is what? Functional nursing. Okay? Task is delegated to individual nurses. But the disadvantage is it is fragmented, there's fragmented care, and there's no accountability. You get it? So let's look at A. Each staff member is assigned a specific task for a group of clients. What's that? Functional nursing. B. A staff member is assigned to determine the client's needs at home and begin discharge planning. That's case management, right? It has nothing to do with nursing approach, nursing model. Okay. A single registered nurse is responsible for providing care to a group of 6 clients. Very clear. What's that? Primary nursing. Right? Don't miss any question from this area. Next. Question number 4 says, the nurse manager has implemented a change in the method of nursing delivery system from functional to team nursing. An assistive personnel is resistant to the change and is not taking an active part in facilitating the process of change, which is the best approach in dealing with the AP. These are situations that you encounter in the unit as a nurse manager, as a supervisor, and there are approaches and ways to tackle. A says ignore the resistance. There's a mistake there. B says exert coercion on the AP. C says provide a positive reward system for the AP. C says confront the AP to encourage verbalization of feelings regarding the change. What's the right answer? The right answer is D. It's showing C there. There's a typo error there. In the unit, you will have people who will resist change. There's a point where they have to be changed. Either they are changing the nursing model, either they are changing the policy, that the policy, that changing the protocol of something, and not everybody will accept to that. And that is why you are a nurse manager and you have to know how to handle the situation. The best course of action is for you to listen. What is the concern of the, why is the nurse resisting? Listen, give a listening ear. Okay, that's the best thing to do. And from there, you would know the next action to take. Let the nurse verbalize, express his or her feelings. That's the best thing to do. Okay, so we've come to the end of our 4 questions on this area. I ask you to stay to the end of this video. I have something very important for you. The next slide. Let's look at interdisciplinary team members. You might have come across questions in this area. The way the healthcare system here in the US is made, like when I first came here and I was practiced, like you have so many persons involved. It looks chaotic and disorganized. It looks that way. But it's so amazing to see the way it goes so smoothly. Everybody knows what he or she is doing. All of these personnel are in the unit at every moment, every shift. Everybody doing what he or she has to do. And you as a nurse, you are supposed to know your team members so that when you need something, you know who to attend to. That is why Nclex is testing you in this area. We have the primary healthcare provider, that should be a physician or any specialist, a surgeon, internal medicine, any other specialist. We have physician assistant. They work under the physician. They carry out the same function, but under the physician. And they assist the physician. If the physician is absent, they can do the prescription and carry out the order of the physician. We have the nurse practitioner. This personnel is an advanced practice registered nurse. They also have duties to prescribe and consult, and you work also under the physician. Some states gives them the autonomy to practice alone. We have case manager. The case manager is always there. You carry out consultation and collaborate with other team members during huddle, during rounds, even from a mission. When you admit, the case manager is there to plan discharge of the patient. The case manager does not provide direct patient care. Get that? So they navigate the insurance system. If the patient comes, the patient doesn't have insurance, they are responsible. They can know how to go about which insurance system to advise, what to do, how to contact. They know all of this. Treatment plan, they advocate, they do refer, they follow up. They know how to plan, discharge plan, if the patient will be going to home care setting or to rehab. Then the nurse supervisor of a particular unit has responsibilities of scheduling and supervising the nurses that are under his or her jurisdiction. And they carry out, they run the operations of the units. Okay. The next team member is a charge nurse. Charge nurses are many. The charge nurse function during a particular shift. You say the charge nurse for today is this nurse. So he or she coordinates other nurses during that shift. The nurse supervisor can delegate them to also do scheduling. Okay. Social worker. Social worker counsels the clients and the family about home care. They also assist the case manager with planning and discharge. Physical therapist, what we call physiotherapist. I did not put anything there, it speaks by itself. Respiratory therapists, they are there. Patients that need ventilation, need oxygenation. Occupational therapist helps disabled clients or chronically ill clients to perform activities of daily living. Don't be confused between occupational therapy, speech therapist, nutritionist. Activities of daily living, bathing, eating, work, all of that, dressing. Walking is physical therapy, especially post-op. Speech therapist comes in to assess if patient has issue with swallowing or speech or communication. Nutritionist, upon admission, you determine that this patient is malnourished or this patient needs a specific diet consultation. The nutritionist comes in to plan diet in order to maintain the nutritional status of the patient. The chaplain is a spiritual support system of the family and the clients, especially during end of life and upon patient request. So the Nclex wants you to know this group of persons so that you know who to go to when you need help. Thank you so much for staying tuned. I hope this section helps you. Take pen and paper, write down some notes, listen to this over and over. There are some questions that come from this area. Thank you and see you in my next video.